So let's go to COTS. COTS, audio COTS MiniCEX is also part of your assessment. Now, COT is also, first of all, let's look at what is a COT. So a COT is, okay, let's talk about MiniCEX first, because this would be, it to make it clearer. So what is a MiniCEX? A mini clinical evaluation exercise is an observed real-life interaction between a doctor and a patient. The MiniCEX assesses clinical skills, attitudes, and behaviors in the non-primary care setting. What this means is that, in layman's terms, if you're doing a hospital rotation, you'll be doing a MiniCEX. But let's go to a COT. The COT is an expanded version of the MiniCEX and considers consultations with real patients in real time during your primary care placement. So to break it down, MiniCEX is done in hospital, COT is done in primary care. Now, what is a MiniCEX? I'll give an example of the MiniCEXs I did in hospital. At times, when my clinical supervisor is around during the ward rounds, because obviously he will not be around every time, he would just say, Nkiru, take a history from this patient. Let's do it as a MiniCEX. And that would be a MiniCEX. At times, he would say, examine the respiratory system of this patient. And that would be my MiniCEX on the ward. So if you do a MiniCEX with your supervisor, you can also be proactive and say, this patient, I want to do a MiniCEX today. Can you observe me do this? Because you have you have your portfolio to tick. So when you've done that, you have discussed, remember, you have discussed with whoever the assessor is that this is a MiniCEX. You have to inform them. You now go to your portfolio, you click on request MiniCEX. If you can see, it's only applicable while not in primary care. Okay. So when you click on request MiniCEX, it goes, you just put your descriptive title, you put your brief description and invite. In hospital, you can also do this for someone ST4 or older. As I said, most of these things are easier in MiniCEX in hospital. You can get your MiniCEX done when you're on call. It's quite easy. Now, a COT. A COT is quite different. And it is done in primary care. A COT is, the difference between a COT and a CBD is that a CBD, you get a patient, you manage the patient, it's a complex case, you discuss it. A COT is usually an observed consultation. It can be observed in real time, or it can be observed later, video consultation, which is something I will talk about. When it is observed in real time, you are in a GP practice, you see a patient, you want to do a COT, you have to inform your supervisor or whoever prior to that time. They come in, they sit in on the consultation and assess you doing the consultation. Now, in the GP practice, it can be quite difficult getting someone to leave their patients to come and sit with you. So you also have to be proactive. In some practices, in one of my rotations, we had to inform the reception about having a COT on a particular day. I used to have my COTs during my tutorials. So they will book in 1 or 2 patients and they will get consent from the patients to do a COT. So my supervisor will come in with his scoring sheet. It can be quite tense. It can be quite, you can get apprehensive because someone is sitting down behind you and assessing you. In recent times, there is now the opportunity to do it via video, which some people prefer. In my deanery, there's something called Iris. I don't know whether it covers all deaneries, but there's a subscription, which is, these are things you need to get to know how it's done in your deanery. There is a subscription that you have to pay for, which is fully reimbursed, and it gives you access to a video recording platform. So what happens is, what they would usually advise, and what I did was, I would come to work, I would set up my phone on my phone stand, I just put it on and record my consultations for the day. And then as I record, I save, I record, I save, and then later on, you can now sit down and choose the ones you want to share with your supervisor. In my last year of training, my supervisor did not want any real life observation, so it was done via video. So what happens is that you do that, you save it, you share with your supervisor, he watches it. In our own case, he would watch it during tutorials, you would discuss it, and he would fill it in. So it would be good to find out in your deanery what obtains. In my deanery, which is Yorkshire and Humber, we have the Iris Connect network where you would subscribe to it and you are fully reimbursed for it. You do your recordings on it, and then your supervisor can watch and score you for your court. In some places, there's also something called an audio court. I never did it, but I know it's an assessment of telephone consultation skills. Okay, I wouldn't say I didn't do it. I did it for one, where my supervisor picked the telephone consultation I did, listened to it, and marked as a court. So the idea and what I want us to get from here is MiniCEX is for hospital, is something observed. Courts can be a real life observation. Your supervisor comes in, sits down. Some supervisors do that, they just sit down and watch you and score you. But some also prefer the recorded ones, which they watch later. You would also see more of this in your course, and I'm quite sure there will be a demo on how these are done. So back to portfolio.